Welcome to the Anxiety Attic, where I make self-help videos for anxiety disorders. I recently used my channel's community tab to ask if anybody had any questions about health anxiety, and I had a great response with questions about health anxiety symptoms, causes, how to manage it, and if there's any possibility of even recovering from health anxiety. So let's get started. I received these two questions about the relationship between anxiety, blood pressure, and heart rate. Now, the heart rate is quite straightforward to explain. When you're anxious, your body thinks there's a danger, so it speeds up your heart rate to deal with that danger. Blood pressure is a little bit more complicated to explain, so I have a dedicated video on that subject, and you can find a link here. So Motion Sheeps asked, does health anxiety raise blood pressure, and why do I always feel my heart beating in my chest and up through my neck? So in short, anxiety does cause a temporary increase in blood pressure, but it's completely harmless and it's a normal anxiety response. Now, the reason you feel it beating up into your neck is that there is a carotid artery running from your heart to up through your neck and into your head. So if you put your hand by there, you can feel your heartbeat. And when you're anxious, the heart is beating so strong, you get a large volume of blood going up through this carotid artery, and that's why you feel it. So again, it's a completely normal anxiety response. It's not dangerous and it's nothing to worry about. Robert asked, can a fast resting heart rate from anxiety cause damage to your heart? And can anxiety also cause your heart to beat slow so that it feels like it's stopped? Now, I'm not a doctor, but I do know this. The heart is a very resilient muscle. It's meant to go faster at times of stress or times of danger. So it's designed to deal with this. So provided you're healthy, there's no reason why you should be worried about your heart failing because you're anxious. Now, there is some evidence that stress and anxiety over a lifetime might have an impact on the health of your heart, but it's not an imminent danger, and many people with anxiety live to a ripe old age. And you have to take into account other factors like smoking, drinking, lack of exercise, genetics. There's many things that affect heart health, and anxiety may be one of them over a prolonged period. So it's important to treat anxiety so that it doesn't become one of those contributors. But you can also offset it by having a healthy lifestyle, exercising, and a good diet. So please don't think just because there's some evidence that anxiety isn't good for your heart that you're in any imminent danger, because you're probably not. As for the slow heart rate, I really don't know. It's not something I've heard of before. But my message would be, why are you monitoring your heart rate? The only thing that monitoring your heart rate will do is make you more anxious. If a doctor's told you you need to monitor your heart rate, that's another matter. But otherwise, there's no need to be monitoring your heart rate. And there's no point really, because the heart rate varies not just from person to person. You know, some people, a normal heart rate is 50. Some other people, it'll be 60 or 70. And it varies massively through the day, depending on what you're doing, if you're exercising, if you're running up the stairs. So there's no point really monitoring your heart rate. And does it feel like it's slow? Don't pay any attention to it. Just let your heart beat. Your heart knows how to beat. It knows when to go faster. It knows when to slow down. So just try not to monitor your heart rate, because all it's going to do is make you feel more anxious. No man asked about how to beat skip beats. Now, skip beats are ectopic heartbeats, and I have a whole video on this. If you have any change in your heart rhythm, you should always get it checked out by a doctor. But if a doctor has confirmed that they're just ectopic heartbeats, then it's usually not serious. But they can be annoying, and I myself suffer from ectopic heartbeats, probably on and off for the last 14, 15 years or so. It's just something that I live with. In my video, I do talk about some of the things you can do to reduce the frequency. That it's helped me, and it works for some people. So you can reduce caffeine, reduce alcohol, exercise, staying fit helps. Stress and anxiety, of course, can increase the frequency of ectopic heartbeats, but they are harmless, and they are just something. If you've tried everything and you're still getting them, and you've seen a cardiologist and they've confirmed that everything's fine with your heart, it is just something that you learn to live with. And I don't get them very severely now, but I've learned to live with them, and they don't bother me. Yeah, other than that, I would say just have a look at my video. It tells you a lot more about ectopic beats. So that covers questions related to the heart. Now, before I get on to the really difficult and possibly the most important questions, let's do some easy ones. Fairy Doom asked, is it better to confront or work through a negative thought or to use distraction? Well, the best thing to do with a negative thought is to completely ignore it and carry on doing whatever you are doing. If you can't ignore it, then you need to challenge it. And you can challenge it using the CBT thought records that I teach in my videos. As far as distraction is concerned, it can actually be counterproductive, and I explain why that is in my video on distraction techniques. Next, how is exercise good for you when exercise raises your cortisol level? Well, cortisol is not an evil hormone, it's a necessary hormone. Cortisol causes a temporary increase in blood pressure, and that can be really useful if you're doing some strenuous exercise like lifting weights. And exercise is good for you because it strengthens your cardiovascular system, it strengthens your muscles, and it releases endorphins, which make you feel good. Now, constantly high levels of cortisol over a lifetime can be bad for you, and that's why people fear cortisol. But cortisol in short bursts, short periods of time, is beneficial. It's not harmless at all. Erin asked, can trauma or bereavement bring on health anxiety? Well, firstly, Erin, I'm very sorry for your loss, but the answer is yes, it can. Losing somebody is an extremely traumatic and stressful time, so it's no surprise that it causes anxiety. And it also makes us think about our own mortality, so it's quite normal to start worrying about your own health. And the problem is that can lead to health anxiety safety behaviours, where we're constantly seeking reassurance about our health. And as I say in a lot of my videos, health anxiety safety behaviours are the fuel of health anxiety. So it's very common for people to develop health anxiety or other anxiety disorders after a bereavement. Dragon J talked about how when someone else gets ill, you automatically think it's going to happen to you. And how do you stop thinking like that? Well, this is quite normal. Your mind just throws the idea out there, and it lets you decide whether it's a threat or not. The secret is to accept the thought, but not to act on it. Because if you act on it, your mind decides this is a genuine threat, and it'll send you that thought more and more often, making you feel more and more anxious. So instead of trying to seek reassurance with Google, which always makes it worse, instead put the thought on trial, using what I teach in my negative thoughts video, which you can find in my health anxiety playlist. Next, two of the most difficult questions. Is there a chance of thinking real symptoms are just health anxiety symptoms? And how do I stop going to the doctor for a second or third opinion? Well, this is the crux of health anxiety. We are all mortal, and we all have to take responsibility for our own health. But if we're constantly obsessing about every possible illness that could kill us, we are truly not living. We have to get a balance between keeping ourselves safe and enjoying the life that we have. And that's where CBT can help. Thought records can help you rationalize. Do you really need to be concerned about having a stroke if you're aged only 16 years old? Now some questions about recovery. M. Manish asked, why despite lots of exposure therapy, he's not getting any better? Well, if you're doing exposure therapy, that's really good and keep doing it. But there are many things that can hinder recovery, but the most common is safety behaviours. So if despite the exposure therapy, you're still doing lots of safety behaviours like Googling symptoms, seeking reassurance or monitoring your blood pressure, that's going to continue to fuel your anxiety. So have a look at your safety behaviours and see which ones you still need to cut out. The other thing I would say, and I don't know whether this is relevant in your case, but you have to make sure that the exposure therapy is aimed to disprove the negative thoughts that you're getting. Let me explain. For example, if you're 25 and healthy, but you're getting the negative thought that I mustn't exercise because I might have a heart attack, then go and exercise because it's going to disprove this negative and illogical thought. However, if your negative thought is, I must exercise all the time to stop myself having a heart attack, then that's going to reinforce the negative thought. So it's not going to be helpful. Now, I'm not saying that you shouldn't exercise, but don't consider exposure therapy if it's reinforcing the negative thought. The only other thing I would say is make sure that you're using all the CBT tools, so thought records, behavioral experiments, and exposure therapy. And then the other thing is recovery time does vary between people depending on how severe their health anxiety is and how long they've had it. For some people, they can make good progress in a few months. For other people, it may take years. Everybody's different, but just keep doing the same things you're doing, if they're the right things, of course. Use the tools, and you will see an improvement. It does work. Simona asked, is it possible to recover from health anxiety, or does it just become manageable? Well, if you've had health anxiety a long time, you're probably always going to get some level of negative thoughts about your health, and you're always going to get some level of anxiety. But if you apply these CBT techniques through your life, you can find that the frequency and the power of those thoughts gets significantly reduced. You see, anxiety is a sliding scale, and you will move up and down that scale through your life. But CBT can help you stay closer to the lower end of the scale rather than the higher. What I'd like you to take away from this video is 3 things. Firstly, instead of trying to treat the anxiety symptoms, treat the anxiety instead. Secondly, the best way to treat anxiety is using CBT tools. And if you do, you'll find that most symptoms will disappear anyway. And finally, be patient and persevere. It's quite possible to reduce anxiety and live a normal life.